And I said, come over, just come on over, you'll say. Yeah.
Good afternoon, ladies and gentlemen, and welcome to the Town of Portland podcast. And we're here in the studio with our first selectman, Ms. Susan Bransfield, and joining us on our phone line is our Chatham Health Director, Mr. Russ Melmed. So, welcome on Friday Eve, Susan.
Yes, good to be here on April Fool's Day. This
Yes.
is April 1 when we're recording. It's good to be here, Dave, and hello to Russ as well. I just want to go over a few things that are happening in Portland these days. Number one, we're in the middle of our budget season, and it seems to be going very well. There's a lot of very promising things that we have in our budget proposal this year, including the addition of a full-time senior director, which I think will be very helpful as we come, hopefully, out of this pandemic and do more activities in our senior center. We're looking forward to that. Also, quite a few of our needed supplies that we need to have for public works, some new equipment that will help us, particularly when we have these awful storms, Dave, where the trees come down. And there's a particular machine that Bob Shea has told us has been so helpful. It's a grapple that is very helpful in picking up some of those big logs and some of those brush matters that we so much have. As you know, we picked up quite a bit of brush this past fall at curbside. And so because we did that, we are not having the annual brush or the semi-annual brush pickup in the spring. We will resume it again in the spring of 2022. So that'll be the next time brush pickup will occur.
Yes, we had to chip Mount Brushmore twice
That's
this
right.
year.
We did. Many people cleaned up their yards, and then after they cleaned up their yards in July, August, we had that terrible storm Isis, and then we did curbside pickup already in the fall. So brush is always acceptable at the transfer station, so feel free to bring it over there, and we'll certainly be able to accommodate those needs. A couple other things going on. Bob has arranged to have some sidewalk repair done on Highland Avenue and East Main Street, so that's going to be starting pretty soon. And then a little bit later in the spring, we plan on having additional sidewalk replacement that will occur between the streets of Cross Street and High Street on Fairview. So on Fairview Street, we have the need to improve those sidewalks, and so that'll be a big replacement project. We're looking forward to that. So with those kinds of things, we know that our dollars are being put to good use in our town. We should have a tentative budget adopted by the Board of Selectmen on April 7, and then that'll go to a town meeting in early May, along forward to a townwide referendum the second Monday in May.
Yeah. You know, our sidewalk committee has done phenomenally in the past few years. We've done tremendous improvements on the walkability of the downtown, and that effort is certainly well noticed by our citizens who love to walk.
Yeah, and it's much safer, and it certainly improves that proverbial curb appeal for all of the houses and businesses that are in the downtown area.
Absolutely. So anyway, all right. What do you got planned for Easter?
Well, I plan on having an egg hunt at my house.
Nice.
I got a hold of Nate Foley and at Parks and Recreation, and I bought 4 of their large bags of eggs.
Yep.
And half of them have little toys in them, and half have candy in them. And my 5 grandchildren are going to come over, and we'll have our private egg hunt that should be a lot of fun. It's supposed to be good weather on Sunday, and we look forward to an outdoor, COVID-safe, fun time.
I think that's what we have planned to as well. No Easter egg. Well, I think maybe my daughter is going to be doing a little Easter for my grandson. But anyway, yeah, I saw your new grandbaby, Sean. He is absolutely adorable.
Of course.
My God. Anyway.
Yeah, as all babies are. We just are so grateful to have youngsters in our town, and fun to celebrate them once in a while.
Sure. We got to have succession planning for sure. So anyway, that's great. All right, Russ, how are you doing out there? They keeping you busy, I'm sure.
Yeah, much of the same. Just busy as ever.
Bigger pile, smaller shovel.
Yeah, I suppose for now, anyway. We're moving into the second year of the pandemic, and it's keeping myself and my staff all very busy. And not to mention that we're moving into the busy part of our season for environmental health work. So a lot of people have gotten or are getting checks from the federal government, from the American Rescue Act, and that is good news for those individuals. What it means for the health department is people start looking around their properties and thinking, well, I've got $5,000, $6,000, $7,000 in my pocket. I'm going to upgrade my deck, or I'm going to upgrade my shed. I'm going to put in that above-ground pool so my kids have a safe place to play over the summer before they get vaccinated, or whatever it happens to be. And all those things go through a permitting process through the health district. So we tend to get very busy in the spring and summer months anyway, but with the federal funding coming direct payments to individuals, it's shaping up to be one of the busiest years we will have had perhaps in the last 20. I think we're already hearing from some local health departments that this is harkening back to the building boom of the early 2000s.
Yes.
Wow.
And so we're anticipating being extremely busy. So I'm extremely pleased that we've been able to hire another sanitarian. So we've had an open position for quite a long time after one of our longtime environmental health specialists retired, and we were happy to be able to fill that position with somebody who's got a couple years experience so they can come in and for the most part hit the ground running. We're going to get them trained up here at our main office in East Hampton, and then actually the plan is for them to be the full-time sanitarian in the town of Portland.
Yes.
So I'm not going to mention names because they start on Monday, so they haven't been officially begun yet, but we're really excited to be bringing somebody else on board, and the timing couldn't be better, frankly.
That's great.
We're also very busy still with COVID-19 response work. We've been running vaccination clinics now for about 3 months, and we expect to continue to be doing that for at least the next couple of months with sort of large public vaccination clinics. We just did open up today across the state to anybody ages 16 or up to schedule appointments. So we opened up 600 appointments this morning at 11 o'clock, and by 11:15 they were all filled.
Wow.
So we open up clinics in VAMS, and that means anybody who has a VAMS account can see the clinic and schedule appointments. And if you don't have a VAMS account yet, you should go onto the State Department of Public Health website and look for VAMS and just submit a simple request to get a login, and you follow the steps to get a VAMS account, and then you can see our clinics and schedule, not just ours but others.
Yep.
But that's how fast they filled up. 600 appointments filled up in less than 15 minutes.
You are popular. Oh, my gosh.
Well, anytime you open up, it's just been the experience. Anytime we open up a new phase of eligibility, and today was the first phase for people who were ages 16 to 44. So it's a pretty big group.
Sure is.
Anytime we roll out a new phase of eligibility, the demand exceeds the supply.
Right.
And, our office has been inundated with calls for people trying to find appointments because they've gone into VAMS and they haven't been able to find an appointment, and they've called the vaccine appointment assist line and they haven't been able to get through, and they've gone to the CVS and the Walgreens websites and there's nothing available. And that's because if you didn't go in and look for appointments at the moment you got access, like last night sometime, you missed your chance.
Yeah.
Wow.
So people just have to keep trying. That's just all I'd say. Don't despair. This is just what happens when you have more demand for supply. And over the next couple of weeks, that will ease. So keep trying if you're listening. Keep trying. Don't give up. Every day, go into VAMS, go onto the CVS or Walgreens website, call the vaccine appointment assist line, and try to get an appointment. So it will happen. If you want a vaccine, you will be able to get it in the next few weeks if you want an appointment. So that's good news. More people are getting vaccinated. I think the bad news is I don't think enough people are getting vaccinated.
Right.
So we're hovering around between 30 and 35% across all 6 towns in Chatham Health District having initiated vaccination, and that's great news.
Yeah.
But we really need to get to 70 or 80%, and we're not close. And what we've seen with the last round of eligibility when we opened up to people 45 plus, that in less than 3 weeks, there was a slack in demand. And that is a worrying trend as we go to younger people. So if you're a younger person out there and you're thinking, yeah, I'm not too worried about COVID-19 because it's less severe for young people and I'm healthy, that may be true on a population level. But on an individual level, you could be the unlucky one who has severe case of disease.
Right.
The other thing I will say is, with not enough people immune to the virus, even if you have a mild course of illness, you are participating in a chain of transmission that eventually will reach somebody who isn't so fortunate.
Wow, yeah.
And it's really, I can't emphasize this enough, you have to start caring about people that you don't know, just a little bit more.
Yes.
Because that's what this means. You're participating in a chain of transmission that will reach somebody you've never met before, who has people who love them, who has a family, who has an important job, and it will hit them and hit them hard. So please be safe. Keep wearing your mask. Keep your distance. Get your vaccine when you're eligible. The side effects are mostly mild, and people weather them very well. So,
sure. Now, is that primarily due to the skepticism, Russ, or is that?
It's really hard to say. I think there's a couple of things going on here. One, there is some general hesitancy around vaccine. I think it started early on when people heard that most of the vaccines being manufactured were using a new technology, which isn't actually true. It was, yes, the vaccines hadn't been made using this technology, but the technology is actually about a decade old. So we've had the technology for a long time. We just hadn't made a vaccine using it.
Huh.
That's part of it, and I think the other part, as we move into younger populations, is people know that the younger you are, the less likely you are to have a severe case of disease. What we also know about younger people is they tend to feel invincible, especially teenagers and people in their 20s. They're very fit, they're very healthy, they're coming into their own physically and mentally, and they've got busy social lives, they just don't want to bother. So that's why I was heartened, for example, to hear the governor say just this week that even though initially the state had not planned to offer specific vaccine clinics for teenagers in high school, 16 and 17, that the governor backtracked and now said that the state is looking at planning those clinics for school-aged children.
Right.
So I think making it easy, doing it in a trusted place from trusted people like a school, I think is a great way to get our 16 and 17-year-olds, 18-year-olds vaccinated.
Sure. Yeah,
exactly. I think the other thing we're looking at is running closed clinics at our colleges and universities to reach people who are in their teens and 20s. I think that's going to be happening in the month of May, using the Johnson & Johnson one-shot-and-done vaccine, which makes a lot of sense to me because 4 weeks after May, college students aren't there anymore.
Yeah.
Right.
So you can't have that second dose clinic at college if college is closed and people aren't there. So I think the state is looking at making the Johnson & Johnson vaccine, pushing that allocation strictly in the month of May to colleges and universities. So I think we're looking at hopefully some uptick in people getting vaccinated. I really hope that we don't plateau at 40, 50%. We really need to get to 70 or 80%, especially because right now younger children below age 16 cannot be vaccinated.
Right.
And that makes up, I think, around 20% of the population of the state of Connecticut.
Mm-hmm.
So
now, what is our infection rate as it sits now? I think it just went up just a little bit.
Yeah, so that's the other thing if there are storm clouds on the horizon. In the town of Portland in particular, our infection rate, just let me look at my numbers, are just about 14 cases per 100,000, which puts Portland in the orange alert level. If everybody remembers the alert level back from the fall or the late summer last year, that's when we thought orange alert was really, really bad. And it is really bad, frankly. Now we're celebrating orange alert level because we've all been so deep in the red for so long that suddenly orange starts to look pretty good.
Right.
The problem is infection rates are increasing. So, 2 weeks ago, Portland only had 4 cases. Last week, 14 cases. This week, I'm pretty sure at the end of today, we're going to find that Portland is no longer orange, but likely red again. And so we're seeing right now there are 4 out of the 6 towns in Chatham Health District are orange alert level, which I guess is good news. But we make up fully 20% of all the towns in the state of Connecticut that are at orange alert level. Most of the rest of the state is red. And I don't want to say it's inevitable. There's nothing inevitable about this. It's all based on human behavior.
Sure.
But, I think we're looking at least, some semblance of a spring surge here.
Right.
There's plenty of COVID-19 out there in our community that if people let their guard down, we'll see a spike in cases.
Well, I'm sure the spring break thing, I think we're just starting to see that balloon
certainly
come through.
travel and people just, even if they're not traveling, being off of school and taking time off and gathering together with friends or family outside your household is what's driving this, at least in part. The other thing that's driving this, unfortunately, are new variants of concern, which we've been talking about for about 4 months now when they first emerged mostly in Europe. But now they're here. We're not doing a very good job looking for them. I think I've said that before. We're not doing enough sequencing to find out exactly how much we have. But modeling done at the Yale School of Public Health suggests that between 30 and 40% of all new cases we're seeing now are variants of concern, principally the UK variant B117, which is about 50% more transmissible than the traditional SARS-CoV-2 virus we've been living with for a year. So that's what's driving this, and we are seeing the numbers increase, especially among young people ages 14 to 24.
Right.
So it's concerning. And I think whatever spike we see this spring, again, not inevitable, people should continue to mask and social distance and limit their exposure to people outside their households, but and do it outdoors if they have to. But whatever spike we see in the spring, I am hopeful that the amount of vaccination that we've been doing, especially among older adults, will serve to do two things. One, flatten the curve so we don't see the same kind of peak that we saw in the winter. And two, really dampen the impact of severe disease. We are seeing hospitalizations increase across the state, but my hope is that because the vaccination has reached many residents who might otherwise be extremely vulnerable to severe disease, that if it reaches those individuals, if the infection reaches those individuals, they'll be protected either from infection or from at least severe disease. So I hope we don't see the kind of surge in hospitalizations and fatalities that we saw in the winter. But we're looking at a spring surge, which really is unfortunate.
Right. Now is the district is still doing a fair amount of contact tracing?
So we're really focusing hard and heavy on vaccination at this point. We are doing some contact tracing, but a lot of the contact tracing efforts are done by the State Department of Public Health. They've got a team of hundreds of contact tracers that are doing the bulk of the work locally, which I'm really thankful for because it allows us to focus on, when there are outbreaks, to investigate outbreaks, and it allows us to focus on vaccination, which is really what's going to get us through this pandemic. But the contact tracing that we are doing are finding a lot of people having small gatherings again. A lot of people having, younger people having birthday parties. I don't know if you've driven around your neighborhood, driven around town. I'm seeing now this is anecdotal, in my neighborhood, for example, a lot of balloons hanging from mailboxes and cars parked down the street. So that's what we're seeing, and we're seeing it in our contact tracing, and we're seeing it in our numbers with younger people now turning up more and more, turning up positive. Right. And people just, it's getting warmer out and people want to hang out with their friends. And unfortunately, and I know this is not going to be a popular sentiment, unfortunately, I don't fully agree with the message that the governor has been sending out about reopening, even though we need to balance preventing infections with having a thriving economy. Right. The problem with the message coming out of our state office is that everything's getting better. Reopen. Capacity limits are now a thing of the past. So I think the message is just louder that things are getting better, and it's drowning out the messages of concern and the messages of, keep your mask on, keep your distance. Sure. So I think people hear what they want to hear, unfortunately, at this point in the pandemic. They want to think things are getting better, and when they hear one person say it, it gives them sort of the green light to do the things that they've wanted to do for the last year, like to get together with friends. Yeah, and then the thing, too, is, Connecticut in relation to, the national trend is doing very well. And I think people see that, Connecticut's, in the top three, and I think that is kind of, being misconstrued a little bit. Well, right. I mean, the national message also for a while has been, reopen. Mask mandates are being lifted in some states. The governor here has allowed many executive orders to expire. And so that the volume of that message is everything's getting better. But in fact, if you look across the country, most of the country is now experiencing a surge in cases. Yeah. And Connecticut is, I think, like you said, third from the top. So our case rates are among the highest now in the country. Right. So we're really not doing that well. If you had told me last summer that this is where we would be, I would be alarmed. Because last summer we were doing so well. I mean, really, in Chatham Health District, 5 or 6 cases across the whole district every week.
Right.
Now we're at somewhere around 60 every week, and I think this week it's going to be much more than that. So
Wow.
I would have been alarmed if I heard myself say that this is where we are now. And so I need to think carefully about that. I don't want to get sensitized to high numbers.
Right. Get out ahead of get out on your skis there a little bit. My gosh.
Right.
Yeah. The other thing, how is the supply of vaccine? Has that been pretty consistent? Coming from the state.
Yes, it has been. We haven't been told that our baseline allocation is increasing, but we ordered 600 doses. Our baseline allocation in Chatham Health District is 200 doses. That's the official baseline that the state says we can expect. But for the last several weeks, when we've ordered more, we've gotten it. So we've got 600 doses coming in next week for clinics. That's 3 times our baseline allocation. So I think the supply is ramping up, which is great, and I hope that continues. And so we'll continue running clinics, and we'll continue getting shots in arms until we see such a slack in demand that running big public clinics needs to shift. And
Right.
At some point we will. At some point we're going to have to talk about how do we reach people who are truly homebound? How
Yeah.
do we reach people who are experiencing homelessness?
Mm-hmm.
How do we reach populations for which transportation to a public clinic is difficult? How do we reach populations that are working 2 jobs and don't have the time to go to a public clinic?
Right.
All these things are on our radar for how we shift our vaccine campaign to the next stage.
Right. Now, has the vaccine been coming? Has it been Moderna, J&J, or has it been a combination of?
For a long time, it was just Moderna. The initial volume that we got from Johnson & Johnson, and we got 600 doses of Johnson & Johnson in the first week of March that helped us vaccinate our teachers. After that, we got nothing for about 3 weeks straight because that vaccine was actually leftover vaccine from the clinical trials that was in storage.
Oh, okay.
So that's why we got a big surge in Johnson & Johnson the first week it became authorized for emergency use, and then nothing since then. But we just ordered Johnson & Johnson. We ordered 300 doses, and they gave it all to us. So next week we're running a 300-dose Johnson & Johnson clinic.
Nice.
On Wednesday at the Colchester Federated Church. So we got a little Johnson & Johnson. I'm hopeful we continue to get it because it presents some logistical advantages compared to Moderna.
Sure, and that's the one and done, correct?
That's one and done. It can be kept stable in the refrigerator for 3 months.
That's
It's
good.
a 5-dose vial instead of a 10-dose vial, so we can we can target our numbers a little bit more specifically. Instead of having to get rid of 9 extra doses at the end of a clinic, we can get rid of 4 extra doses at the end of a clinic.
Right, exactly. So that's good. That's encouraging. So,
Yeah.
Especially now that, summer's coming and, kids are going to be coming home from college and all that kind of good stuff. I think the dynamics are going to change a little bit and go from there as far as summer. Now, what are you seeing as far as in relation to summer activities? How are towns handling that?
Yeah, so I think we're still at a point where I'm not recommending, that people do large carnival type of activities. I know that there's typically a carnival, for example, that runs in May in the town of Colchester. They didn't have it last year. What I recommended and what is required actually is you can have 50% of what your attendance was the last time you did the carnival. You can have 50%, but you need to be able to maintain control over how many people are coming in. So let's say you run a carnival in the middle of a town green and there's no fencing up or anything like that. How do you maintain some semblance of control over people coming in?
Right.
So I think people need to be mindful that there's still going to be the need for people to wear masks, to maintain some control over entry, into these things. So you're going to, 100% capacity doesn't mean you can have an infinite number of people. Capacity is still a number given a certain space.
Right.
So I can't emphasize that enough. When people hear, oh, we're at 100% capacity, or the governor says there are no capacity restrictions, what the governor is actually saying is 100% capacity is acceptable, but that is still a number. So, if people are planning activities, I think that's great. Outdoor activities are fantastic. Make sure you reach out to the fire marshal to find out if you're doing it in a particular space, what the capacity is for that space.
Mm-hmm.
And the fire marshals, they know how to calculate capacity for spaces. They have all those, algorithms that they know how to do those things.
Right.
But doing things outdoors, I think even, things like farmers markets, some fairs and festivals, we'll probably be seeing those things. And I think those are all great things. But so long as everybody does them safely, keeps their masks on, so long as those events are held with keeping in mind we don't want shoulder-to-shoulder people.
Mm-hmm.
So we still want to make sure that we're making those things, setting them up so that people can stay 6 feet apart.
Right.
I mean, I think that's kind of the key.
Yeah.
Keeping distance, keeping masks on, and then for the most part, outdoor activities are really safe things that people can do.
Yeah, I think it's going to be interesting too, going back into the fall, and as we embark on the fair season. How many fairs are going to happen. You've got the Big E, you've got all the town local fairs. I know most of them, I think, are from the local standpoint we're still planning to do a fair. So it's a matter of going to see how the the whole thing shakes out as we go through the summer.
Yeah, I think the fall fairs are things that they're probably going to happen. If I'm looking into my crystal ball, the spring events, those might be a little bit dicey. If anything's supposed to happen in April or May, it might be a little bit more challenging. There might still be, like I said, for carnivals and things like that, there's still a 50% capacity restriction. But for the large ones, the fall, the fairs and the festivals and things like that, I think those, especially if they happen in the fall, I'm really hopeful. But people need to get vaccinated, and we really still need to keep our masks on. It's probably the most important thing you can do, even when you're getting together with people that you know and you're comfortable with.
Sure.
Especially if you're doing that indoors.
Exactly.
Keeping your mask on, and that will get us to a fall where we can have all those things, and we can have something that looks normal almost.
Right, exactly. So, okay. Well, that's great, Russ. I'm glad you're keeping busy out there.
Oh, that's for sure.
As far as that goes, but yeah, I think from that standpoint, I think the schools are, again, they're fluctuating in and out as far as I think most all schools are pretty much full on, with the exception of a few quarantine classes. Correct?
Yeah, most schools are fully in person or have plans to go fully in person, even at the high school level at this point. I think the new CDC's guidance that indicated that 3 feet of distance in schools with masking and ventilation and disinfection is, roughly equivalent, or there's no statistically significant difference in terms of transmission rates to 6 feet of distance between students. That's why masks are so important, ventilation is so important, disinfection is so important, testing is so important. All those other things that have to get done are so important, but it really is looking like we can open and operate schools mostly, or if not all, fully in person in a pretty safe way. I know that, I live in Colchester, my daughter's a high schooler in Colchester, and it looks like they're planning to go full in person at some point after April break.
Mm-hmm.
I know the middle school is, so we really see very little transmission in schools, and that is still the case.
Mm-hmm.
That's great. We are seeing some transmission on sports teams now, so sports were allowed to resume recently after the winter pause.
Yep. Mm-hmm.
We are seeing some transmission. It's difficult to determine if the transmission is occurring on the court or field of play as opposed to in social engagements before or after games.
Right.
But sports, there's more to sports than playing the game. And so,
exactly.
What I would say to families who are having their kids participate in sports is, it's great. Practice really hard. Go to the game,
mm-hmm.
wear your mask, and go home. Let's try to limit the amount of social engagements that you take your kiddos to, where the whole team is there, especially if it's indoors. I think I still am not recommending that people go and have the traditional, pizza, after the game.
Right.
Where if I think back to my childhood, that's what we did after the game. Everyone went and got pizza.
Sure, exactly.
I still would say refrain from that if you can, just for a little while longer.
Yeah. Now, as far as the probability of in-person graduations, what do you see in your crystal ball?
I see graduations as being in person, and perhaps largely even with families.
Outside or?
Yeah, outside.
Yep.
I see that happening. I think we're waiting on the state to send some more specific guidance. If you remember this time last year when we were talking about graduations, there were restrictions to the number. Many were drive-through.
Mm-hmm.
Nobody that was outside of your car was attending. There really were very few graduations that took place in person outside of a car.
Mm-hmm.
I think we're looking at probably graduations taking place outside of drive-throughs with people, with families watching. That's what I'm predicting.
Okay.
That's not official. I'm not making the official word. I expect the state to provide some formal guidance on that soon. I've been having a lot of conversations with superintendents, including Charles Britton, about the potential for proms.
Mm-hmm.
I think that's a little bit more dicey. We're talking about kids who can't be vaccinated engaging in activities, things like dancing, where I wouldn't be recommending, at the risk of sounding like the preacher from the movie Footloose.
Yeah.
For any listeners who've seen the movie, I would say proms with a lot of activities that the kids can do that aren't dancing, that are all outside, with everybody wearing masks, maybe is something that is reasonable to do.
Well, I think the clothiers have an opportunity now to add masks to the repertoire of of gowns and tuxes.
Instead
matching.
of just being seen in your gown, you're seen in your mask and whatever kind of stylish silk mask you have or whatever.
Exactly.
I hadn't thought about that, but sure, that's another accessory that people can show off.
Sure, exactly.
But proms, really, I think it's still a high-risk type of event, and I would hate to see proms impact academics at the end of the year. So, for example, when are AP exams scheduled?
Right.
I would hate to see a prom result in the need for quarantine and then disrupt those end-of-the-year academic activities.
Right. So, time will tell. That's for sure. For sure. So, great. All right, Russ, I appreciate the update. I think, Susan, what else we got?
I think we're all set, Dave. It sounds like the more people that get vaccinated, the better we will be off and certainly be able to do those activities that Russ just talked about. Yeah. So if you have the opportunity, get your vaccination. I know you and I have been fully vaccinated, yep. Dave, and doing well and feel confident, and I hope others follow suit.
For sure. So, all right. Well, thanks, Russ, for coming on, and give our best to all the staff out at Chatham Health is all the great work that your staff does, and in conjunction not only with the town of Portland, but all of the rest of the towns in the district. So,
will do. Can I just insert one comment here at the end?
Sure.
How much I've appreciated having Susan Bransfield on my board as first selectman in the town of Portland, and I hope that you will consider continuing on with Chatham Health District Board even after you step down as first selectwoman.
Oh, thank you, Russ. I do enjoy being a member, and certainly that'll be up to the new first select person, whoever he or she shall be in November. But yes, I would certainly love to continue to serve. It's a wonderful regional program, and you do such a great job as our director. I can't thank you enough.
Well, thank you, and thank you for your support.
Yeah, we're not going to let her go that easy. we got to keep a leash there.
I had to make the public pitch, so it's heard on the podcast.
There you go.
Exactly.
Thanks, Russ.
Well,
appreciate it.
We got to have her back. Maybe she can host the podcast.
There you go. Yeah,
going
I could be
forward.
the emeritus.
There you go. Fantastic. Well, thanks, Russ. Thank you, Susan. Okay,
all right. Sounds good.
That is our Easter version of our Town of Portland podcast. I'm your host, Dave Kuzminski. We're here in the Town Tech Educational Podcast Studio at Portland High School. And as Russ bops off the line here, we want to wish everybody a happy Easter and a happy Passover. Again, stay home, stay safe, wear your mask, and above all, socially distance. So have a great Easter. Thank you. Thank you for joining us today. I'm your host, Dave Kuzminski. Please tune in every week for new and relevant conversations about the town of Portland. You can find us at portlandct.org or at YouTube/Town of Portland, and now wherever you listen to your podcasts. If you've enjoyed our podcast, please consider subscribing and sharing with friends. This podcast was produced by the Town Tech Educational Partnership Program, which is a partnership between Portland High School and the Portland Town Hall. If you're looking to start a podcast for your business or organization, check out towntech.org/podcast to learn more.